Generally speaking, sodium tells you about water, not about salt. Okay? All right. So let's zoom in and look a little bit more at that. So we have two ways to be hyponatremic. You can either have too little water and too little salt, or you can have too little salt and too much water, right? So hyponatremia with dehydration versus hyponatremia with overhydration. Overhydration is the common. Dehydration with hyponatremia is the uncommon. Why? Because usually in dehydration you lose the water and the salt stays behind, right? So your osmolarity goes up. So this is an unusual dehydration, and you can see you need to have something else happening. Either your adrenal, your aldosterone system is busted, right? So you're not holding on to your sodium. Or you're on a diuretic that has broken your aldosterone system for you, okay? So so that's this case. Hyponatremia, overhydration, okay, first off, you just have too much fluid on board. Second, would be too much ADH. Antidiuretic hormone comes from the pituitary. It normally responds to osmolarity, but in tumor situations or in head trauma situations, ADH is released and it shouldn't be. So you have a body that has too much water and is holding on to every drop. See the problem? So you have a broken system. Another way you get this bronchogenic tumors, some tumors secrete ADH. You know how we talked about that in neoplasia, how some tumors will produce biologically active molecules. This is an example of that. Okay, so sodium concentration in both cases is low. That's what hyponatremia tells us. The next question is the one you have to answer. Is the extracellular fluid volume up or down? Is the intercellular fluid volume up or down? So if we're overhydrated, both are up. If we're dehydrated with hyponatremia, intracellular fluid tends to be better than extracellular fluid in terms of, they're both too small, okay, but the ECF is has less volume than it should, more so than the intracellular. Now, flip side, hypernatremia. Okay, high salt, high plasma concentration of sodium. Most common, dehydration, right? So lack of access to water, could they be in this box? Diabetes insipidus is a disorder of ADH function where you don't respond to ADH. So essentially, even though you're dry, you're peeing a lot anyway. Okay, so you can imagine that's not going to go well. Excessive sweating can do this too. Now here you see both ECF and ICF are decreased because this is our classic dehydration. The weird hypernatremia with overhydration, now you have to have some other issue. Your aldosterone system has to be stuck on. Okay, that's essentially what's happening here. So that your sodium is up, but your ECF is also up at the expense of your intracellular fluid volume.